After the first treatment, which was 1 year ago, there were immediate changes with eye contact and a sense of humor also. We decided to come here to Belgrade every 6 months, and this is our third time. His speech is more fluent. Like 2-3 months after the treatment, you see more and more results. He knows he's coming back to a safe place. I think one of the reasons for him to wanting to coming back, it's the staff.
It's your first time in the clinic, right?
Third time.
Third time?
Yeah.
Okay, could you share some background about your children, introducing the diagnosis?
Well, he was diagnosed with autism at the age of 2 and 4 months. We wanted, because of COVID, we couldn't diagnose him earlier because of what happened. Since then, we have been trying to find him like a special kindergarten, which we did, and we changed his diet for unprocessed food, and we also give him broccoli sprouts, but we also know that he needs more intervention, and like medical intervention. And my wife started digging and see what she can do, and because we didn't want to leave him the way he was, because he wasn't communicating very well. So she found on Facebook this family who have experienced with their children what they were going through and the changes they had been going through, and she told me that we have to do it. And I searched it, I read about it, and I said, fine, we have nothing to lose. I mean, as long as nothing bad happens during the treatment. And after the first treatment, which was 1 year ago, there were immediate changes with eye contact and a sense of humor also, which I wasn't accustomed to because there was none of that before. And we were very happy about it, and we decided to come here to Belgrade every 6 months, and this is our third time. After the second time, there was even more eye contact and even more dialogue and expression of feelings. Like now he tells me that he's shy many times, which is amazing because there is a fine balance between being shy and having autism. So now we know when he's being autistic and when he's shy, which is great. And he tells us whenever he's sad and bored, and this is amazing. This is after the second treatment. Now I have to say that since then we've also been experiencing highs and lows. Sometimes he can have bad days where his communication is poor, but we also know this is one of the let's call it side effect. I don't know how else to call it of the treatment. So for every low there is also a high, and you don't know where it's going to happen. But now I can say that after the third treatment, the lows are still high and the highs are much higher, and which is great by itself. So these small changes, which are not that small for us, keep on giving us the motivation to come back. So we said, me and my wife, we said that every 6 months is a good time for us to see all the changes during that time, during this periods, and let you guys, let the Swiss Medica know about them and keep on coming.
You mentioned that you have noticed improvement right in the clinic, right? Or I didn't understand you correctly.
The first time, yes. After the first day, we noticed.
After the first...
The first day, after the first day of... It's crazy. I mean... but it didn't stay that way. I have to emphasize that. It didn't stay that way for long. I mean, there was like a big high. Even now when you're interviewing me, my son this past few days also got treatment, and his behavior changed. It was a bit more hectic, more his speech is more fluent, which is great and not so great because now he's all over the place. But I'm not worried about that. I think and I know this is his body's way of reacting to the treatment. It doesn't necessarily mean that it's wrong. I mean, nothing can go wrong with this treatment. This is what we've learned during this last year. So if there is any message I can give the viewers, is that all these changes, it's never for the bad. If there are changes, it's only for the good. If there are bad changes, they are only temporary. It will go away. Like for him to be more scattered, more all over the place. These are sad moments sometimes for us, but we know deep inside that they will pass. So I hope I answered your question.
Yes. Did I understand you correctly that after each round of the treatment you have noticed improvement right in the clinic? Or after
the second time, no. And not an improvement, but a change, which is a good sign. As long as there is change, it means that he did something, and like 2-3 months after the treatment, you see more and more results from the treatment. This is also very important for viewers to understand that all kids, they react differently. I mean, your kid can react to that 5 months after the treatment. This is why we keep on coming every 6 months and not more often. So we can see those changes. We need to let time do its course and let things happen, so we can view from the side and let us know what has changed. So this is something important for the viewers to know. Yeah.
And have your life as a parent changed in some way?
Of our lives or what?
Yeah, because I assume that being a parent of autistic child, it's quite challenging. And have you noticed that something changed in terms of your quality of life, you as a parent?
From the day we diagnosed him, you mean?
Yes, and right now.
Yes, lots of sadness, lots of like knowing that he can be bullied in school, knowing that we will always have to take care of him in one way or another, knowing that he is different. You can tell he is different when he's around kids who are normal. But we having all of what I said before about the diet and the broccoli sprouts, and now this, which is the greatest change. I mean, this is an era where I can do it, where I can have hope. Before that, people used to tell you that it is what it is. You just you have no cure for that. And by the way, we're not expecting to cure his autism. We know it's not going to happen, but it can improve certain aspects in his life. So it's the combination of being sad many times, but having hope and seeing the results whenever we see them, because now he's not afraid of being around many children. He's not afraid of that. Before he used to cry, before he used to panic. And even now when he's a bit silent next to them, because I know he's shy, because he tells me. So this is amazing. It's also the autism, yes, but it's a lot less than what it used to be. So there is a combination between being sad and hopeful. And glad when you see those days when he's high, you're also high, and these days as they combined, they create these happy days when you know, okay, let's just make it happen most of the time and not just one of those times. So there is hope. This is what
And what is the most important improvement in your opinion?
Having the ability to speak to him like normal conversations, like knowing how he feels, teaching him things. He is able to calculate, is able to read the clock now. He's able to do many things on his own, which he couldn't before. And now I don't know what you expect of a 5-year-old to do, but the fact that he's willing to learn and not just be all over the place. When he sometimes is, but still he wants to learn, and this is amazing for me. Otherwise it would be like, you know, going for the TV, going for the phone, but many things he comes to me and he tells me that he wants to learn things, which is great. I mean, this is amazing. 1 year ago it couldn't have been. It was a fantasy, and now this is happening. So yeah, this is one of the biggest changes.
Dr. Solana, would you like to ask something about improvement changes, because I'm going to deep dive into a different topic?
Okay. So you mentioned that now he wants to learn. Maybe you can point some things that he learned during this year, something new.
I can tell you that yesterday we talked about reading a clock, but now I'm not talking about digital clock, I'm talking about dials. And he wanted to learn that. He wanted me to bring the book that explains on how to do it, and we also have this miniature clock that made of wood, and he wanted me to show him the dials of what to do, and I would test him to see what time it is many times, which is great. Now this happened only in a hotel room when it's only the both of us, otherwise there is no way, right? But the fact that he came to me and asked me is very, I don't know, it's very inspiring, I think. We buy him all these, I don't know how to call it, notebooks, not notebooks. You buy it in the store, and again with the mathematics and everything, he wants to learn all of that. I mean, we buy it for him, but he goes to that. And yes, sometimes we initiate the learning, of course, but many times he does, which is also encouraging. And knowing that he has the smarts and the will to learn, which before it wasn't like that. And some people might say it's the age that is progressing with age, so it wants to learn, but no way is it an age thing. I know it's the intervention of the therapy here, of the treatment we are getting here. So yes, this is very encouraging. And what else? He knows how to take shower. I don't know. Again, for us, it's seeing other 5-year-old children and trying to be like them, but knowing that not everything is possible. But we always look up to see how we can be like them in many ways. So he dresses from a long time. He dresses up by himself. He takes shower by himself. He does everything by himself. We encourage him to be independent, because we always try to see what 5 years old are like in many other aspects in life. So when it comes from him, when he wants to Like, I know it's a simple action, but when he wants to zip up his coat by himself, this is great for me, because he was used to, in a way, be very more passive, and now he's more active, wanting to learn, wanting to try. I think this is, if you need to edit that, wanting to try is the biggest change. For him not to give up easily and wanting to try on his own.
You mentioned that now he has a kind of sense of humor. Maybe you can remember some joke or something that made him laugh.
Well, the fact that he knows when I'm having a sense of humor, but in his way, he tells me when I'm making jokes, and when he's making jokes, is like for him to surprise me with magic things. And Father, look, I did this and that, and it's like, and he shows it to me, and he starts laughing about it himself. It's like he's making himself laugh in a way. And mostly it's like very childish things, which I don't know if it's premature or not premature, I don't know. But he's making jokes sometimes from stuff that he sees, you know, and he starts laughing about them. It's not the normal sense of humor where he can read between the lines and joke and laugh about something. It's very obvious things, and he makes them a joke. And as long as for him it's funny, it's also progress for me, because he wasn't like that before. So I hope I answered the question. I don't know, I'm not sure all the time.
Sure, he is a child still, he's very small, so his sense of humor will progress with his age.
Yeah, I guess, but it's a different sense of humor, right? It's still, let's call it, it's not politically correct to say, but it's an autistic sense of humor. But it's still a sense of humor, which is fine by me, as long as he has one. And we can accustom ourselves to his sense of humor.
And what type of stem cells did you receive?
Well, the first treatment we decided to try with placenta stem cells, and the second treatment we were advised to try the umbilical cord stem cells and see which one is more effective for Ari, my son. And after trying both, we decided to keep on using the umbilical cord kind of stem cells, and we are hoping for the best. Yeah, and again with the exosomes, but you will know it later on. Yes, if you try.
Okay. And how was the procedure? Was it like, did you make any kind of sedation or?
No. In our case, we, like weeks before the first treatment, we showed him what's going to happen to him, like with the needle and being inserted to his hand, and because we knew he was going to be afraid of that, but we kept on doing that every day and calming him down, and for him to know what's going to happen. And this is with the combination of many sweet things after, and hugs, and having the phone next to his eyes with the TV shows that he likes. It made everything a good experience. Despite the bad feeling from the needle, it made it a good experience. And now I think after the third time, even after the first time, he wanted to come back to Belgrade, because also you have lots of things to do with the kids here, like malls and gymborees, and it depends on the seasons, but you can find many things to do with the children and make it a very positive experience for them. So all in all, I would say it is a positive experience.
Mm-hmm. About the communication with doctors, nurses and staff in the clinic, did you experience some difficulties, problems that someone didn't understand you, or it was difficult to explain what do you mean? Or
None whatsoever. Everything is. Their English is better than mine for sure, but no, it was very clear, and I have to say that coming back here is great, because one of the main things that I love about this place is the hospitality and the warmth and kindness, and Ari gets lots of attention even though he doesn't give it back. He still gets a lot of attention, which is amazing for me, because I think in next times we will come, and there will be next times, he knows he's coming back to a safe place, which is amazing, because I think one of the reasons for him to wanting to coming back, it's the staff. Yes, he doesn't talk about it, but I know it, because the way they keep on embracing him whenever he comes, and I think this is great. I think, yeah.
What are the things that you didn't like, or in other words, how it can be better, in your opinion? What should we improve?
What should be improved? I can't really say. I mean, well, I think maybe I can tell you what has improved is the food.
Okay.
Yeah, the food. For me and for Ari, it's a lot more tasty now than previous times. Yes. But that is changed for the better, so I don't have anything to really say, honestly. If there will be something, I will tell Anastasia. Maybe you can edit it after.
Okay. Thank you very much. I think that's it.